People, power, health. The kinds of people that our first presenter deals with and has dealt with are familiar to him because he has been one of them. And the model for treating the conditions that he has seen in his medical practice are conceivably a model for the way we should think of health much, much more broadly. But please welcome the Chief Medical Officer from the Hazelden Betty Ford Foundation Clinic, Marv Seppala.
Privileged to be here at the most incredible healthcare innovation conference on the planet. It's also a privilege for me personally because my life began anew right here in Rochester, Minnesota. I grew up 11 miles south of here in Stewartville, a small town. Some of you may have heard of it. But for me, it was a difficult time. At age 12, I started to use alcohol. Shortly following that, other drugs started, and by 15, it was daily. I dropped out of high school at 17. And I didn't find care here at the Mayo Clinic. Although all my health care occurred here at the Mayo Clinic, I didn't find care for this disease at the Mayo Clinic. Fortunately, my family got me to Hazelden, the place that I'm now the chief medical officer of. It's about 2 hours northeast of here. While there, I was put on a unit with other men and told I had a disease. I didn't buy that. I didn't think it was a disease. Most people still don't think this is a disease, addiction. It's actually a lifelong disease, and I still have it. I just don't express it anymore, or I wouldn't be standing here today, I suspect. Nor when I was in high school would I ever have thought that I would be standing here today. Nonetheless, they told me I had a disease and I was responsible for this disease, that it was up to me to do something about it. And then they told me what I could do about it. They told me what I needed to do about it. And during the course of my treatment, I argued with them for 2 weeks trying to convince them that I didn't have this disease. And that's part of the problem. It's a brain disease, so you don't recognize it yourself. And that's one of the biggest problems with this disease. But after 2 weeks, something changed. And it wasn't my recognition of this disease. It was my recognition of a connection with the other men that were there with me, and in particular with one counselor, Ed Juergens, who was a big, bald Scandinavian. And he scared the crap out of me when I arrived because he was big and bald and Scandinavian, and as was my father and his father before him, mean, stoic Scandinavians. And so Ed, just upon initial impression, was someone I was not going to talk to. However, when Ed opened his mouth, something else came out that I didn't expect. And Ed spoke about love, and he spoke about connection, and he spoke about spiritual principles and how to lead one's life sober and differently than I'd been leading it. And somehow that got my attention. That broke through all of the difficulties I had admitting what was going on in my life. And it was that connection that convinced me that this was worth looking at, that maybe I do have this disease, even though at the time in 1974, they could not have defined this as disease if they tried. There just wasn't evidence of it. Now, there was really obscure research at the time, but it wouldn't have been adequate to convince anyone it was a disease. They sent me away after 4 weeks, a standard course of treatment at the time. There were no services in this area available to me for follow-up, except one. They told me to go to 12-step meetings. And I lived in Stewartville. There were no 12-step meetings in Stewartville, and I'd never heard of them. They got me back into high school. I'd dropped out of high school. And I chose not to do what they told me to do. I would have had to drive 11 miles to Rochester to go to an AA meeting, to do something I'd never heard of before. So I didn't do it. Within 5 days, I was right back where I was before I came to treatment, using multiple drugs and trying to hide it from everyone, especially my family. I got to go through the graduation ceremony without a diploma, and then my family kind of caught wind of the fact that I was back to the same old things, and they disowned me and kicked me out of the house. So I moved to Rochester, if you can call it a move when you throw a few of your belongings in the back of a Volkswagen and drive 11 miles away without a place to land and just kind of go from friend to friend's house, bumming around without money. And I got a couple jobs, and I'd get a paycheck and I'd disappear because money was really tough to handle when you could buy a bunch of drugs and use them. It was hard to get back to work. And ultimately, luckily it was summer here because I was living out of a car between friends' houses. And I applied for a job as a janitor at the Mayo Clinic. Now, IBM and Mayo are the two major employers here. My father worked at IBM, and I just assumed he would tell them about me, and there's no way they're going to hire me, so I applied here at Mayo. And I applied to be a janitor. I thought that's all I can do. I lied and said that I'd graduated from high school, which hadn't happened yet. And they sent me away. They didn't have a job. 2 weeks later, my mother received a call. I had to give an address and a phone number. She got a hold of my girlfriend, who got a hold of me, and I end up back at Mayo for an interview. They send me over to a cardiovascular research lab where I am hired as a lab technician. I was hired under two world-famous researchers, John Shepherd and David Donald. John Shepherd was the president of the American Heart Association. He was on the board of governors, the board of trustees of the Mayo Clinic. Was out of the country at the time, and I still think David Donald played a joke on him by hiring me, so when he returned in his lab, this technician, this addicted, long-haired kid, would be waiting. David Donald was an eccentric physiologist who helped invent the heart-lung machine. Fellows came from all over the world to work under them, and that was where I was suddenly surrounded by the science of medicine. I actually didn't use drugs or alcohol for 2 weeks, my personal best, without any kind of help at all, without doing anything else, just because this was such an incredible job. I found a stimulation that I'd never experienced in high school, intellectual stimulation. And I learned about scientific inquiry, about discipline, about innovation itself, and about respect for ideas. They involved me in the lab meetings as an 18-year-old who said he graduated from high school. Now, the day after I was hired, I actually went to HR and told them that I hadn't graduated from high school, and I made up another lie about why I hadn't graduated and said that I committed to graduating very soon because I've been seeing my teachers in their homes, and that was partially true. I had done that a couple months prior. But that commitment, I actually started to honor. And then I missed a week of work because of my disease. And I was so frightened that I would lose that job because it seemed like things were starting to turn around for me. Something incredible was happening, but it also was this connection I had with these people in the lab and the recognition of just how special this was. I had no clue what it meant to me, but I knew that I really enjoyed being there and doing what we were doing and thinking about these things and meeting these people and looking up this science about how arteries and veins constrict. And it was out of that that a desperation arose. I didn't seek help for this disorder when I went to treatment. That was an intervention, forced upon me. But at this moment, I had a decision to make, and it wasn't because of the diagnosis. It wasn't because of the treatment planning what they told me to do when I was in treatment at Hazelden, it was out of pure desperation. It was out of the consequences of my disease, which so often is how we seek help. It gets bad enough, I finally go to the doctor. It got bad enough, I finally did what they told me to do, and I went to a 12-step meeting. There were 3 men there. They were all over 70. I was 18. And I can't tell you what they said. I have no idea. I can't recall what they said. It was a Sunday morning. It was about 1.5 miles just south of here on 3rd Avenue. 3rd Avenue goes right outside the door here. A 1-story cinder block building. And those 3 said something to me that got me to come back the following week. I have no clue what they said. I know that there was a connection similar to what I felt while I was in treatment at Hazelden. And I will say that as I returned, that meeting started to grow, and I saw things that I never expected to see. I started to feel hope because I witnessed that in the other people and what they described to me. I was accepted even though I couldn't even stand myself and what I'd done. The shame was overwhelming. But they didn't see that in me. They saw something else. And I like to say I was loved back into existence because that's exactly how it felt. I did not care about myself, and these people cared about me, as did the people in the lab in a remarkably different way. And so my life was remarkably altered by 2 incredible forces. One spiritual, because 12-step programs have a spiritual basis to them, and one scientific in a laboratory, a surgical laboratory surrounded by people from all over the world. And it was out of that experience that I decided at some later point after getting a high school degree, I actually have a diploma from Stewartville High School, and I saw my transcript once, and it says I missed like 8 days randomly during my senior year. It was a remarkable gift, so that I didn't have to explain the 4 or 5 months I missed my senior year when I applied for college. I came back to Mayo for medical school and was influenced further by the same forces, heart and mind, spiritual and science. John mentioned the Dalai Lama here today and Mayo in the same sentence. And I think that's how we have to begin to look at medicine, and it's certainly how we do it in our facilities. And I can do that every day naturally because the current model of treatment in the United States for addiction, and actually worldwide, the overwhelming model is a model that we helped establish back in the late 40s, early 50s, and it's based on these same 12 steps, which have at their core a spiritual emphasis. And only recently has the science of addiction caught up, so that now we actually have medications and specific psychotherapies for addiction, but up until recently we had none of that. We had 12-step programs. And if addiction had been treated in the healthcare system, because it wasn't, our program and all the other programs around the country really developed outside of the current healthcare system back in the 40s and 50s and later. Only recently are we trying to get involved in the healthcare system and align with the healthcare system. But some of the difficulty with that is exactly why it couldn't have happened there, and it's that how we do things has a spiritual emphasis in addition to a scientific basis. When you think about addiction treatment in a spiritual basis, one alternative manner of looking at it that was described by George Valiant, who wrote Spiritual Evolution, is to think of the positive emotions. Positive emotions won't be found in any psychiatric textbook, and yet they're part of our everyday lives. Only recently have the psychological textbooks even begun to mention the positive emotions, because a small school of psychologists are starting to popularize them and do remarkable research about them that have shown that the positive emotions when we express them, especially in concert with another human being. When you think about love itself, love can't be expressed without somebody else. And there's an alignment of neural pathways in the two individuals when that's occurring. And out of that alignment comes remarkable change in brain function. This research exists. And out of that, there's even evidence that love itself can alter feelings of depression, increase pain thresholds so people don't feel as much pain, and alter blood pressure and pulse. This list of the positive emotions that Valiant describes is not the only list, it's his list. There's other people that see it a little bit different, but in general, they're always the same. And in the last chapter of his book, Spiritual Evolution, he used 12-step programs as the greatest example of how these positive emotions work in people's lives. When I walk into a 12-step meeting, multiple people will come and give me a hug. That doesn't happen very many places. And they're glad to see me, even what I've said and done. They accept me. And as I said, I think they loved me back into existence. Now, I've been abstinent over 40 years, so it's a remarkably different situation than when I started and I was the youngest person there. But what I would like to describe as well is how, in the midst of an opioid addiction crisis in the United States, which most people don't know about, where we have overdose deaths from prescription opioids and heroin on a daily basis, the daily death rate closing in on that of the peak of the AIDS crisis, and no one knows about it. How can that be? And in response to this crisis, we had to alter our treatment programming. This is one of the founders of Intel. Even he had positive emotion in this quote that's on the Institute of Technology in San Jose, California. Optimism is an essential ingredient of innovation. How else can the individual favor change over security? As an individual, favoring change over security is so remarkably difficult. As a corporation, as a culture, as a healthcare system, we have to be optimistic. We have to have positive emotion. And in our setting, recognizing that we didn't adequately treat opioid use disorders, we had to change them dramatically, and once again use the science and the spirit, use this foundation in the 12 steps, in addition to the medications that have been found useful for the treatment of opioid use disorders and the new psychotherapies, all of which is evidence-based, in combination to treat this illness. And my hope is that we can start to do so throughout the rest of medicine as well. In my ideal world, an expression of love with all the attributes that have been found in the research on positive emotions would be just as important in a healthcare professional's interaction with a patient as their vital signs, as their diagnosis, as their treatment plan. What a change that would be from the current system. And if we're going to be human-centered in our approach to the treatment of illness, how better than to be using the center of humans themselves and express love to each other in the healthcare setting. I hope you enjoy this conference. Really excited to be here, and I'll be here the rest of the time. Thank you very much. Oh, John. Hey.
So Marv, thanks so much. That was great. Can we think of the evidence-based neurophysiology of love that you talked about, this alignment of brain function, as a scientific definition of the benefits of engagement, that if people find a role to be involved with somebody else or with their own care or just with the system itself, that has a beneficial sort of impact on their brains, and that so much of healthcare involves bringing the patient into the equation and making them part of the team?
It would result in a remarkable change. And it really has been shown to alter how we think. Love itself opens the mind to other possibilities. It's been shown in real direct research that happens. And so under duress, in the midst of significant illness, to have that happen could be transforming to the individual and align them, engage them with the healthcare worker.
Does this work even when there are bad outcomes? In other words, when a bad outcome is unavoidable, how does that engagement help, and how is that not what people might think of as just denial or delusion?
I can't link that to any research, but I can say that seeing bad outcomes throughout my healthcare experience, and when one can align with people using the positive emotions, using love, absolutely alters what happens in that setting, what happens to that individual and to the others involved, because it's usually multiple people and there's a bad outcome. And even the attorneys, tell us, if you've made a mistake as a physician, talk to the patients and tell them about it. The unfortunate truth is the trouble really happens when we don't communicate under that circumstance. And even when we make a mistake, to be able to do so could be a positive outcome.
So we have to maintain a sense of optimism, even though we understand that we make mistakes, so that we don't fear confronting our mistakes and tolerate a growing sort of negative situation that we don't want to deal with, be it a toothache, be it litigation. And that is a way of thinking about preventive care, because I think a lot of people have a difficulty thinking about what is preventive care, when what it really is getting rid of these fears of dealing with things in a simple, just talk to the patient, talk to the people solution, as opposed to bringing in the lawyers. How does that? How can we think of preventive care in a practical term?
Yeah, I liked what you said earlier about language and chronic illness, more like chronic health instead. And I think if we can change how we view ourselves with illness, the people knew something was wrong with you because of your wheelchair. I could have walked by the same people, they'd have no idea about my disease. And yet, I have an illness that lasts a lifetime that I have to be aware of and attend to on a daily basis, so I could fall right back into the same, mess. And it requires that I communicate about that I engage with other people about that. And because of that, I'm able to continue to address it in a positive way. And I think that's possible with any illness.
So the power of asking about people in your community's health situation, what they're concerned about, and communicating about your own is the seed of creating a more rational and preventive-oriented healthcare community that then the system, we don't even need the system for that. We don't even need hospitals for that sort of thing.
We don't. We don't. We can do it elsewhere, but to have it occur in a hospital setting, to have it occur when under the worst of circumstances, could actually be of benefit to all participants.
So you're an MD, right?
I am.
Can I just get a hug, or do you have to prescribe it? Thank you. Thank you, Marvin.
Thanks, John. Okay.